will focus on strategies for engaging local news media and bloggers, enhancing your odds of getting media coverage. Just a little housekeeping before we get started. This webinar will be recorded and will be available along with the PowerPoint slides. It will be posted on our UCSF COTAX website. If you have any questions during the presentation, please type them in the chat box. We'll be answering all questions at the end of the session. Now, without further ado, we'll turn the time over to Matt. Matt Jacob is a communications consultant who works with public health stakeholders across the country. Previously, he managed communications for the Pew Children's Dental Campaign and the Children's Dental Health Project. Mr. Jacob has offered his insights on health literacy and other communication challenges to a variety of audiences, including the American Public Health Association and the National Academy of Medicine. In 2014, he was named a Health Literacy Hero by healthliteracymonth.org. With that, I'll go ahead and turn it over to you, Matt.
Good morning, everyone. Thanks, Keiko. Appreciate the introduction. I'm looking forward to engaging with you about an important topic and one that is always a challenge. We know that it's important to raise awareness of the kindergarten oral health assessment by directly communicating with and engaging parents and caregivers and families, as well as school officials. But we sometimes overlook those indirect ways that we can reach those audiences as well. And the media, both the news media and other forms of digital media, play a big role in that. And so I want to walk you through some considerations as you think about your strategies. All of these might work, some of these might work. Obviously, the bandwidth, your capacities differ from one location to another. I recognize that, but I'm going to give you more of a comprehensive look at this, and hopefully you can come away with some tips, some ideas that will help you hone your strategies as you move ahead. So these are my objectives. I want to lay the groundwork for successful media outreach. As I suspect all of you know, February is National Children's Dental Health Month, and it's an observance that's been around for decades, but it's a nice month to leverage for this purpose, and certainly KOHA is a great way to kind of talk about oral health during that month. I'm going to also explain what it means to put a face on the issue of oral health and why that is so important to not only engage media, but the public. And then last but not least, I'm going to share 10 tips for successful outreach to reporters and other media. And so I do hope some of you have some communications and media staff with you who are able to participate in this. If not, please share the slides or share some of these tips with them. I realize there are a lot of seasoned communications people out there. Most of this may be stuff they're already well aware of, but there may be a tip or two or some suggestion they could still find of interest. So let's first talk about the groundwork, sort of what we want to put in place to be successful in media outreach. So it's called a news release for a reason, right? And that is, it needs to be news. You're not going to get reporters and editors and other people in broadcast media and print media and digital media very excited about this unless you can really demonstrate what is newsworthy about this. And so for that reason, I want to kind of step back and make sure that we all have kind of a shared understanding of what it means to be presenting news. Kind of what are the boxes you need to check. So what is it that makes something newsworthy? And I think there are several things here, and this is just a list of them. Information that's new, information that identifies a threat to lives, health, and property. These are things that we sort of intuitively know. Helpful if it affects more than just a few people. If something that happens to one or two people, generally not thought of as news unless it's a celebrity or someone like the President of the United States or the governor. Yeah, those people by nature, people are kind of interested in knowing what's happened, what have they done. But usually news that happens only to one person, not likely to be the kind of thing that the media is going to want to cover. The closer it is to us, obviously that's important. So is it happening in or near our community? I think it's also important, and this is one that tends to get overlooked, is information you can present that shatters assumptions. And we're all guilty of this. We all make assumptions. You meet somebody new, you hear what they're involved in, what they're into, what they do, where they work, and you have some immediate assumptions about that person and the work they do that may or may not be accurate. And so, that's really important for us to throw something out there that is going to surprise people. Last but not least, of course, certain famous people, what they say, what they do tends to be viewed as news regardless. So, this has been a big issue in California and a lot of areas with climate change and other dynamics at play. Wildfires, forest fires, and it's newsworthy for some very obvious reasons, right? It's new, a fire that just broke out, and as you know, media often will update it and give it a new aspect because there's another brush fire over here, and officials are concerned that it might connect with the main fire, which could have some really disastrous consequences. Has it reached kind of a new level? How much damage has been done? So new information, even if the fire itself has been going on for a while, as many of you probably noticed in your local news media when they covered the wildfires recently, that coverage was regularly updated. They wanted to feed you new information. The second check, no surprise, right? We know by nature fires are a danger to lives, to health, to property. And, this is obviously affecting more than just a few people. And the interest and probably the coverage level of the media was shaped a lot by where you were in the state. So, if you were living in Southern California, the focal point was going to be much more the fires in that area. If you were in Northern California, the Sonoma fire, right? So all of that, local. So, but let's kind of switch gears here, right? So we're talking about oral health, and we're really focusing on children's oral health. So what about that? How does that kind of fit into this matrix? How is it, or might it be news? Well, these three are pretty easy to grasp, right? Obviously it affects lives, health, property, something like that is going to impact health. And so you kind of check that box. It's affecting a lot more than just, 3 or 4 or 5 people. And the extent that you're talking about the dental health of children in your community, in your county, in your city, obviously you've got a very local angle to it. But these are the two things you really want to try and check the box for, right? And so, what can you really say that is new, right? So it's always interesting to me that, new is a word that really is within the word news for good reason. And that really is important. People look for that. They don't want you to tell them something that they already know about, that they've heard several times. What's new? And then shattering assumptions. So what can we do that helps to convey those 2 points, that checks those 2 boxes? So let's first look at the new. Well, you can mention the observance of Children's Dental Health Month. That's in February. Yeah, that's new. That kind of gives it a hook in terms of time, in terms of the calendar. But we should just view that as a start. Most reporters are not going to say, oh my gosh, Children's Dental Health Month, we should spend a lot of time on this or write a front page story about this. That alone is it's a nice little sweetener. It's kind of the gravy, but it's not really going to get a huge amount of attention by itself. So then answering these kinds of questions, I think, is really key. Are there new data? Is there new information that you can share that points out the number of kids that are getting the kindergarten oral health assessment? How many are not participating in KOHA? And sort of what's the trend line? So that's going to be the kind of data that a local reporter, an editor, a blogger, people like that are going to want to know pretty quickly right up front. And then, what about new strategies or new partners? That's kind of a nice little thing to work into. Just to say our health department or our nonprofit is really committed to doing this, okay, that's fine. And people might kind of expect that. But can you point out that, we've formed a partnership of 9 local organizations, and we're working, we've got a plan to engage parents, and, anything you can do that sort of shows that you're taking new steps, you're taking new approaches to try and raise awareness of KOHA is very, very important. So just kind of keep that uppermost in your minds. Assumptions, how do we shatter assumptions? And that's really so key is the stories that tend to interest us when we're, on our smartphones, when we're kind of scrolling through our Twitter or, our Instagram feed or wherever we're getting news or watching TV in the morning. The things that we tend to remember are things that surprised us, things that we just weren't aware of and kind of are a little surprised that we didn't know that, right? And I think that, my experience talking with dozens and dozens of reporters over the past 10, 15 years about health issues, I feel confident that most reporters do not know this fact, right? They do not know tooth decay is the most common chronic disease for children and teens. And it's a fact. And when you share them the website of the CDC and show it to them, they're like, oh, wow, okay, yeah, I didn't know that, So, things like that. I'm not saying this is the one and only fact that you should share, but it's definitely something to consider. It can be a nice way to kind of establish that context. You can make it really much more school focused, right? So, the whole point of KOHA is to get that assessment done before kids are in school for, 2, 3, 4 years. We really want that done by the end of their first full year in school. So, really being able to link it to school readiness, to school performance, to school attendance is important. Some reporters may just not be aware that dental problems are one of the leading factors for school absences. So definitely something to kind of consider as well. And it doesn't have to be an either or. Somewhere in your press materials, your news release, that kind of thing, you can mention, 2 or 3 of these. This was a statistic from some years back. My understanding is that we have some new data from the same research institute. And so, but having a statistic like this, I think, is also kind of another wow moment for most reporters, for most staff writers, most, journalists who are out there. They're not going to know that this is going on, that this many kids are, missing school at least one day because of dental problems. So these are things you really want to have at the ready. You don't want to get too deep into any conversation on paper, online, or in person with the media without really throwing them a curve, really surprising them. And that kind of leads me to this example. So, you really want to check these boxes early. Say you're drafting your press release, you got your news release and you're ready to go. You want to get it out a couple days before Children's Dental Health Month. And, that's something key to think about as well. If you wait a week into February to send this out, leveraging the month's observance is just not going to be quite as meaningful. So, really look to try and get this out that last week of January. But here's what I'm talking about. So, what is new? What is timely? Work that in right away. And so you want to get kind of the new element in there, but shattering assumptions. So it might be the, most common chronic disease of children. You might choose to get more specific and use that data point about how many kids were, missed school at least one day in California. And, while data and research and formal reports, that's really a great source for the shattering of assumptions, don't overthink it too much. Let's suppose that someone told you that there was a survey done of school nurses in your county, and they were asked, what are the major factors, health-related, that cause student absences? And, dental was like the second or third leading reason. That's important, and that could be shared as well. So, it doesn't have to be like a formal published study or a report from some university. Even some of those other elements, call it gray literature, call it what you want, but there are other locally based data points that can also be useful. So as you develop a news release and any related materials, I want to throw out to you the idea of using a structure that covers these 4 bases. I call it the Cpass structure, and it's just a way to kind of really think about how your message flows, and are you really delivering news? Are you really providing information that's likely to get attention? And so that shattering of assumptions, that helps provide context, right? Why should I care? That's the silent question that every reporter, every blogger, everybody out there, when they get an email from somebody that maybe they know, maybe they don't know, their first thought is, what is this all about? And, why should I care? What does it mean to me? And if they don't think it's going to interest their readers, they're probably not going to do much about it. They'll ignore it or just delete it. So, really giving them some fact, some statistic, real quick data point that will grab them. And then a little more specifics on the problem, being able to speak to this. And, I mentioned adults or children. You may just want to choose to focus completely on children. That kind of clarifies it. But, this doesn't have to be a data point. It can just be a real quick sentence. And then the action, right? People don't want to be left up in the air. What are you doing about it? What's the answer? What's the approach? So you want to answer that question. And then solution is a little different than action. It's sort of holding out that hope. We really feel we can make progress if we implement this plan, by working together, our county can be healthier. Here's what we're doing. So that's kind of Cpass is an outline I recommend you consider using. And the odds are that I think you'll find it helpful. Other people have found this helpful just as a way of organizing the structure and flow of their messages. I think something that is really important to know, and I think most of us kind of know this, right? If it bleeds, it leads. There is a bad news bias. And so we have to take that into account, because it means that we sort of need to lead out with something that might be maybe a little more negative than we would want. So, and I think it's just, we have to realize most news is bad news. And so, just for example, so every day in the United States of America, hundreds and hundreds and hundreds of airline jets take off and they land safely. Never makes the news, right? Why should it? Right? We expect it. It's kind of something we just take for granted, whether we should or not. It's the crashes. It's something like that makes the news. So it's kind of the same way, with regard to other health issues, other public issues. When it comes to, instead of saying 1 in 4 children in our county received a dental screening or a dental assessment, you really want to frame it in the negative way. 3 in 4 children in our county are not getting this kindergarten oral health assessment, and we want to change that, and here's what we're doing, right? So you kind of want to flip it to kind of so that you word your data, your statistic, in a way that is negative. What needs to be fixed, right? What's the challenge here? Don't focus on the progress that you've made. Focus on what the problem is, right? That's the P in Cpass. So really got to make sure you nail that point. Putting a face on the issue is really important, and it's probably one of the most difficult things to do for a variety of reasons. So if you step back and you just take a look at, newspapers across the state of California, digital media, you look at National Public Radio, all kinds of places, you see that a lot of issues about health and wellness tend to be covered in this way, right? They don't go very deep in the story without introducing you to a someone. And that might be a health provider, it might be a patient, right? So they really like to present news as a story. They're kind of telling you a little bit of a story about the people who are affected by an illness or a condition, the people who are trying to help keep them healthy. So this is just something really important. Washington Post wrote a story about the uninsured and the challenges they face. What did they do? They led the story by focusing on a 61-year-old woman and sharing her story of the challenges she has because of her health insurance status. And so, you know, this is really important to journalists. And so that one of the first things that if they are interested, one of the first things they'll say is, you know, well, who can you point me to? Who can I interview and talk to about this? And, you know, you don't want that pregnant pause of like, wow, haven't really thought of that. You know, really want you to think about that now, so that when February comes around, you have 1 or 2 or 3 or 4 people you could point them to interview. You know, another example, even on social media, right? This is a health policy expert on healthcare issues, and she's writing here about a boy who's severely disabled from Idaho. So, you know, they really, in many ways, talking about issues, talking about the challenge through a real person's situation, you know, it's what I call putting a face on your issue. It just means that it matters more. So statistics are very helpful, but we really want to humanize the challenge and the story as quickly as we can. So 10 tips for media outreach. Let's go through these. So first and foremost, very important, right? It's kind of garbage in, garbage out. You know, you want to work with your local communication staff, review the local media list they have. Some of you probably use an automated system. There are a variety of them, Vocus and others out there that sell media software, and you can do searches and track the people you want to send a news release out to, and that can be great, that can be fine, but it still is worth double checking that list, seeing who's on there and who's not. There may be a local blogger or someone that just doesn't quite crack that list. They were overlooked. Radio show hosts might or might not show up. Local NPR affiliates, this is the kind of story that they would probably be quite interested in if you present it to them the right way. So, you know, looking at NPR affiliates in your area, you know, they might even not only just cover it for news, they might agree to interview someone from your organization on a radio show. Maybe they do a 1 hour or half hour public affairs program every week. You know, they're constantly looking for guests. So, you know, definitely something to keep in mind. But you want that list to be solid, not to be disorganized. You know, you want to make sure it's updated when you actually start this process. So you can have those people in your software. You can have them on a list, a spreadsheet, you print it out, that's great. But how familiar are you with these individuals who are writing about local stories, about education, about healthcare? You know, it's helpful to skim some of the articles that they've written or posted recently. That way you'll just know a little bit more about how they tend to think, how they kind of approach the issues, what topics they've covered. And this is a case where, because KOHA is so connected to the educational sector, that there are people who might write about education, but might write about this and be very interested in covering KOHA if you very much present it to them in that kind of school readiness frame, rather than just kind of speaking of it as a health issue and not really talking about that connection. The third tip is to decide on what your media pitch is. The media pitch is a fancy way of saying you've got 2, maybe 3 sentences max, and you've got to get their attention. You'll email it to them, maybe you'll text it to them. You know, what are you going to do that will really make them go, oh, this is worth scrolling down and reading about? So, you know, you really want to try and grab their attention as quickly as possible. And that's where Cpass can help, kind of just organize your thoughts, you know, giving them some context right up front, you know, making it clear what the problem is. As they read it, they're saying to themselves, are my readers, are my listeners going to care about this? And so that's really, your pitch needs to make them answer that question, yes, I think they will. So I'm circling back now, number 4, the 4th tip goes right back to, you know, the importance of putting a face on your issue. So this is where it really pays to spend some time, identify a parent, a dentist, a pediatrician, or some other key person who can be interviewed by the news media. Being able to say, hey, actually, yeah, I do have somebody that you could interview. Reporters are really going to appreciate that. Reporters work hard, but you know what? They work so hard that they appreciate anything you can do to make it easier to cover your story. So if you say, yeah, I've got 2 or 3 people who I think can give you different perspectives on the importance of oral health and education, and I'd be happy to send you their names and email addresses if you'd like. Most of them are going to say, cool, I really appreciate that. You've given them a head start. If you force a reporter to step back and go, okay, let's see, who could I talk to about this? The more difficult you make that for them, the more likely they'll be drawn off to some other story. They'll write something else, and they might not come back to this. So do some brainstorming with your colleagues. Think about people in your county, in your community, in your city who are probably already involved as a partner with you on this issue. And so, the kind of people who offer that expertise. I think it's always great to get somebody from the healthcare field, dentists, dental hygienists, people who manage a clinic locally that see a lot of kids, especially young kids, can kind of talk about the impact of dental disease. Having a parent or parent advocate, also very important. And, even somebody from the education community, having a local teacher who will talk about how poor health impacts school performance, talk maybe a school nurse, think broadly. But reporters love to connect these issues with real people. Fifth, you want to decide whether a news conference or a real-time event of some kind is worth doing, right? It takes a lot of time and planning. It may not be, but it's something to at least have a conversation about. Just so you are aware of this, I think most of you are, it kind of makes perfect sense, right? TV, probably not going to be interested unless you have a really cool visual or something that is going to look really good on TV. TV is about visuals. So if this is a more cerebral topic, they can't really think of like an obvious, kind of visual angle. Just might not be quite as interesting, quite as sexy to a reporter in terms of coverage. But there are other things you can do. Keep in mind, so Facebook Live events, they're becoming more and more popular. So it doesn't necessarily have to be a news conference. You could think of how to leverage social media platforms to do an event as well. So think about it. It's worth a discussion, and it probably is going to be based a little bit on the bandwidth that you have as an organization or department. Very important, choose that date, choose that time. When are you going to send out the news release? When are you going to hold the media event? And if you're holding the media event, you're going to want to send a media advisory out 2, 3, 4 days in advance, right? So, what you really want to do is back time. That's the best way to plan. Okay, what date are we sending out our media advisory, our news release, that kind of information. And you need to plan backwards. Okay, so knowing we need to finalize our news release, what does this mean? How much time are we going to need to get this through the approval process? Because, most situations you can't just write a news release and immediately send it out, right? It's got to be reviewed and approved and so on. So you got to build all that time in, and as I say here, when you're drafting this news release, that also includes talking points. So the people that you identify, parents, parent advocates, health professionals, school and educational staff, that's great, but it's always helpful to supply them with talking points. I think it's really essential. That way, at least they understand how you're talking about the issue, how your agency or department or organization is talking about it. It makes it easier for them to kind of stay on message. So, just give yourself ample time to get that done. These things always take twice as long as you think they're going to take. So just build in that time. And you know what? Your interviewees and your speakers, they will really appreciate getting talking points from you. They may not need them, but it's just a nice little safety blanket for those, even those who have done interviews before. It's kind of like, oh, okay, this makes it a little easier for me. I can kind of review these and make sure I don't make a mistake, right? So just, definitely want to have that. The prepping is very important. So, I think it is a good idea. You probably will know these people somewhat. You can ask them, have they done interviews before? You want to assess their comfort level. And, you know, if there is time, you know, and you can work with them, meet them somewhere, have them come by, you know, your office, organization, and, you know, take some time asking them questions and let them practice, right? So, you know, and make sure they're not getting too jargony on how they talk about oral health or education. So, you know, spending some time like this really pays off. Sometimes you've got some very seasoned people who've done a number of interviews, that's great. But many of the people you identify and want to make available to the news media, you know, those people are going to appreciate being prepped in some way, or at least having the opportunity to ask you some questions about, you know, what should I wear? How should I, what if they ask this question, right? And so you really want to make sure that they feel as comfortable as possible. The more comfortable they feel, better job they're going to do. You want to also kind of think of the 2 or maybe 3 questions that could be the toughest for them, right? The easy questions, they're going to handle fine. That's why they're easy. We call them easy. But what about the tough questions? And one that I think you really want to make sure that you and your spokespersons are ready for is what I call the responsibility question. I think some of you probably guess what I'm talking about here, but I want to make this very clear. So, you know, sometimes you'll get that question from people, well, you know, why aren't these kids getting, you know, assessed for their dental health? You know, is this just parents not exercising their responsibility? Why aren't parents taking them? Why do we need an organized effort for this? Shouldn't they be going to, you know, the dental office anyway? So you want to be prepared for that and respond to it in a way that doesn't fall into this kind of defensive trap. That this is not a question of, you know, are parents doing what they should do? Parents have so much on their plate and so many things they are doing and want to do for their kids. Anything we can do to raise the profile of oral health and its importance, we want to do that. That's what KOHA is about, you know. So really just make sure you don't get kind of trapped in that, because some people may ask that question and it's just such a negatively kind of tainted sort of question. You don't want to get trapped into that. Create some sample messages. Shouldn't take that long, but, you know, having, you know, 4, 5, 6, 7 messages that people can take, basically copy paste, maybe tweak a little bit if they want, and use on Facebook, their Facebook page, their Twitter account, other platforms. You know, your partners, your friends, your allies, they're going to really appreciate that. And, you know, if you want them to amplify your message and what you're doing, then, you know, this is just a real important thing that you can do for them. So not only that you're going to be sending these messages out, but encouraging them to do so as well. Which leads me to the next point, which is you want your partners to have really good advance notice of what you're doing, right? If you're going to be sending a news release out announcing, you know, a new approach that you're taking to increase, you know, KOHA completion by children, more of them participating, then, you know, let them know what date that's going to go out, what you're planning, if you're doing some kind of news conference or Facebook Live event or whatever. Just keep them in the loop. You can't expect them to support and amplify your messages if they're caught off guard, right? So just making sure they're looped in, they're going to support you, you know, and the odds are, you know, they're looking for new information and social media content and so on. So by letting them know about this, they can lean in and they can help support and contribute to that message getting out. Social media, I talked a little bit about this during the first webinar. I want to circle back again. You know, social media, yeah, it's distinct from what we generally talk about as media outreach, but we really shouldn't think of it as a completely different box. And sort of, here's why. We know that many reporters, bloggers, editors, they have a presence on social media. I find that Twitter tends to be their favorite platform. It's not the only one. Some of them kind of lurk on Facebook. They kind of lurk on Instagram. What they're trying to do basically by having this presence is a couple things. You know, actually 3 things. They promote stories that they've written or produced. That's just one more channel they can disseminate. And they also monitor the issues that people are talking about. What's, issues that already interest them, trying to get a sense of what's the buzz, what are people talking about. And then they're looking for new story ideas, things maybe they weren't aware of. So, there's a lot of this going on. And, here's sort of an example. So Jenny Gold is a reporter with Kaiser Health News, so, she's using this to push out and amplify a story they did about vaping recently. So, that's what she was doing here. Teresa Boyle is a reporter for, I believe, for the Toronto News. So, she, this was a nice little pat on my back, but I pushed some story out. She follows me, and she actually shared the story as well on her account, and, recognized a couple of us who had, shared or pushed out that story. So, again, that was it's kind of cool when a reporter sort of notices what you're talking about and kind of amplifies it to a broader audience. Sarah Cliff, she's been a journalist in Washington for some time. She recently moved over to the New York Times, and she wrote this really incredible story. So she used to be with Vox, the digital news site, and that Ezra Klein started many years ago. So she did this really big expose on ambulance bills and just how high they were and how a lot of health systems were getting pretty aggressive about, trying to get those paid in full, even from people who clearly were, who were struggling, who were living their lives paycheck to paycheck or even in more dire circumstances. And so, she used Twitter to say, hey, thank you for sending me your ambulance bill. She used Twitter as the vehicle to tell people, hey, I'm doing this story, I want to get any copies of bills that you have. So here she's saying, hey, this was great. You all sent me your ambulance bills. Now I'm going to do a story looking at medical bills. I've got this form. Can you fill it out? So she used Twitter to really get a good sense of medical bills, how their lives have been turned upside down by medical bills they just couldn't pay, medical bills they just weren't expecting because they were given a sense that, the cost would be much lower, and then they sort of got this bill that was 2 or 3 times higher. So, you really can find a lot of media people on these platforms, particularly Twitter. So definitely worth, kind of checking them out and sort of being aware of who's there from your county, your community. It could be helpful. I mentioned hashtags earlier. They're very important. When you post messages on Facebook, Twitter, Instagram, those are kind of the 3 that I think of much more when I think of hashtags, because they help you break out of your cubicle and reach people that you might not have. So if you're, a county health department, making sure educators see that message, thinking about what hashtags, like maybe there's a hashtag on school readiness, things like that, as you're starting to promote these issues, that's really important. And I think the key is, start raising your presence on social media now. Don't wait until, January 28th to do it. Just think of maybe trying to post, an extra message or 2. If you're not in charge of social media platforms for your nonprofit or health agency, if you have your own presence, that can be a way to also share information or data too. So, starting to really kind of talk up oral health, children's health, these kinds of issues, it can be helpful to leverage that as well as you get closer to February. So, got, I think, about 20 minutes left, and I know I've covered an awful lot of ground. I want to leave ample time here for people to ask questions, to chime in with comments, to let me and others know about any strategy they've used that has worked, that they felt really good about in terms of bringing an issue to a local reporter's attention. Sometimes we think really big, like, oh, I want to get, the San Jose Mercury News or the LA Times to cover this. Don't overlook those community and weekly newspapers, those underground newspapers. You know, they have audiences, they are read, and a lot of times they're a little more concerned kind of on a micro level about what's going on in schools and communities. You know, it's certainly something not to take for granted. It's always great to get a big article or story or coverage at a high profile media outlet, but you know, those smaller media outlets, they're interested, they want to provide information about the community, about health and wellness, and so you know, definitely want to keep them on your radar screen as you move forward. So Keiko, I'm open for comments, for questions that anyone might have, and hopefully we can have a good conversation.
Yeah, well, thank you, Matt. That was a really wonderful presentation. You really touched on a lot of good points on laying the groundwork and, you know, for how to do the media outreach and share. You shared us great tips for successful outreach. So we would like to open to questions. If you'd like to unmute yourself, you can push *6, or you can type your questions on the chat box.
Hi, can you hear me, Matt?
Yes, I can.
Okay, this is Mary Jane in Los Angeles, and I appreciate this webinar, of course, and all the talking points that you gave to us. We are planning to finalize a LAUSD school board report and include a lot of the talking points, but also, you know, Senate Bill 379 is all pro opt-out consent, and the school board is very hesitant to move forward with that in spite of the fact that other school districts are doing this around the country, including in New York. And I'm wondering, you know, how we might be able to craft that message, because the district is, you know, understandably concerned about legal implications if something goes wrong, you know, the risk that might be associated. And I know it's limited, but I don't know if there is a strategy about how to promote specifically opt-out consents as are indicated in the Senate bill, or what thoughts you have.
Yeah, well, we should probably have a longer conversation offline, and I'm happy, you know, reach out. I think you have my email address, and we can talk this through some more. But yeah, I realize as February approaches, even long before February, you may have issues, needs like this that crop up that require you to very much, you know, step up a media presence and have a message for the media, not just, you know, to decision makers. Yeah, I think, you know, there might be, you know, you might kind of consider whether there's a way to kind of play off that term opt out in a creative way that kind of demonstrates why it's such a bad idea. And this is kind of a little bit still baking in the oven, but I'm just wondering if there's a way to kind of take that term and kind of present it or package it in a way that just sort of demonstrates why, you know, opting out is, you know, it's like, you know, it's opting out of school success. It's, you know, this kind of opt out. It's opting out of health and wellness. It's opting out of things we don't want to opt out of. Every kid, every child deserves, you know, X, Y, and Z. So I mean, maybe there's some way kind of creatively, but I feel like I know like 60% of what you're talking about, and I would love to have an offline conversation with you, and let's talk it through some more, because I can appreciate the challenge that you're facing, and I know you want to really feel like you've got a streamlined, focused message for that. So please do reach out.
That's great. Thank you.
I also, I invite anybody who has an approach they've taken on a different issue. Maybe it's not related to oral health, but we can also learn collectively from tactics, strategies that you've used in the past few years, maybe to get attention to an issue in kind of in a way that you weren't sure whether it would work or not, and it did work. Maybe an approach you took that didn't work as well. All those kinds of lessons, feel free to share an experience like that. I think, we all gain by just having some of that insight.
So we still have a little more than 10 minutes. So if there's anything you would like to share, what worked with your county, be a nice time for you to share and kind of learn from each other. And I also wanted to remind everyone, if there's somebody in your team that wasn't available today to listen to the webinar, we will have this recording posted by end of the week, and the PowerPoint slides are already up on our website.
Keiko, one more thing I want to just throw out. So those of you who are kind of starting the planning process for February or, thereabouts, and if it would be helpful to get on the phone and just, talk through some of these plans you have or strategies or any questions you might have. I am certainly open to, making myself available for an hour sometime in early December if people want, as they're starting to think this through and they're kind of piecing together what their plan is and starting to tease out some of the key messages. I'm happy to, make myself available to offer any initial feedback that you might want, and hopefully that could be useful as you move forward.
Yeah, well, thank you, Matt. That's a very wonderful opportunity. And then I also wanted to say that since you'll be doing a presentation at the PDM, it'll be nice to kind of have everybody meet you and talk to you in person.
Yeah, I'm looking forward to it.
Okay, well, thank you everyone for joining. I'll give you back the 12 minutes out of your busy schedule. We appreciate you being here today, and we look forward to seeing everybody at the PDM meeting in Sacramento on Tuesday, November 19th. Thank you so much, everyone.
Thank you.